Hi, um, hello everyone. My name is Ronicia Walker Diggins. I attend ECBI University. The course that I'm in is NUR 4561 Senior Practicum. My instructor is Dr. Holland. So my project is evidence-based and service training on pain management and patient comfort in the PACU. All right. So this project was implemented in basically the post anesthesia care unit at Bon Secours in Newport News, where staff identified challenges with consistent pain reassessment and comfort rounding after surgery. These inconsistencies affected both the accuracy of pain documentation and patient satisfaction scores. So, the purpose of this project was to improve staff competency in assessing and managing post-operative pain while also enhancing overall comfort and the recovery experience for patients. So to achieve this, I followed the 5 steps of evidence-based practice model, asking a clinical question, acquiring and appraising the evidence, applying it in practice, and then evaluating outcomes. The project was carried out over 4 weeks and involved developing and implementing a structured in-service training program using educational tools, mock scenarios, and post-test evaluations to measure improvement in staff knowledge and patient care outcomes. All right, project goal. So the primary goal of my project was to develop and evaluate an evidence-based in-service training program focused on improving pain management and patient comfort in the PACU. So specifically, the training aimed to enhance the staff's ability to perform accurate pain assessments and timely reassessments, both of which are crucial in ensuring optimal recovery and patient safety after them having anesthesia. Another component of the goal was to strengthen the communication among the PACU team, especially between nurses and the anesthesia providers and CRNAs, ensuring that the patient's pain levels are clearly reported and addressed promptly. Ultimately, by implementing structured training and reinforcing comfort rounding, the project sought to support better patient satisfaction, outcomes, and overall the quality of care within the PACU environment at Bon Secours. All right, so the achievement of objectives 1 through 3. So, objective 1 was to review at least 10 current peer-reviewed research studies on pain management and pain comfort specific to the PACU settings. This literature reviewed provided a strong evidence-based foundation for designing the educational materials and interventions used in the project. Objective 2 was to design and deliver an interactive in-service training session for the PACU nurses. The session included PowerPoint slides, handouts, and a pain assessment toolkit that reinforced key evidence-based practices. And then finally, objective 3 focused on evaluating learning outcomes. I used a pre and a post test to measure the staff knowledge gains along with surveys to collect feedback on the training's useful and acceptability. The results showed significant improvement in understanding pain management strategies, and staff feedback reflected high satisfaction and enthusiasm for incorporating these practices into daily care routines. All right, strategies and evidence. To complete the project strategies, I began developing a detailed lesson plan, PowerPoint presentation, and educational handouts for the PACU staff. These materials focused on pain assessment accuracy, communication during handoff, and comfort rounding techniques. During the in-service training, I conducted a mock patient scenario and role play exercises that gave staff hands-on experience applying the comfort and the pain assessment tools in real-world situations. Each participant completed a pre-test before the session and then a post-test afterwards. The pre and post test comparison allowed me to measure knowledge improvement and identify areas where additional reinforcement was needed. To ensure effective engagement, I applied adult learning principles, recognizing that nurses learn best through practical application, peer discussion, and intermediate relevance to their clinical roles. This interactive approach encouraged participation and helped connect evidence based concepts to everyday PACU practice. All right, strategies and evidence. In the second phase of implementation, I created a laminated pain scale reference tool and placed them in the PACU bay, um, close to where the computers are. This helped reinforce consistent pain scoring and ensure quick access to standardized assessment tools. We also emphasized documentation of comfort rounding. Nurses were reminded to document every pain reassessment, which typically in my department, we do it every 15 minutes. Pain comfort intervention in real time, which improve accuracy and accountability. My mentor, Yvette Inge, observed staff during these sessions and she validated their competencies and progress. Her feedback confirmed that the nurses were demonstrating improved accuracy and consistency in their reassessments. Overall, the strategies were effective in translating evidence into practice. The visual tools, the simulation exercises, and the mentorship support together created a positive learning environment and meaningful change in clinical behavior. All right. Outcomes for the nursing unit. The outcomes of the project showed clear, measurable improvement in the patient care and staff performance. After implementation, the unit recorded a 40% increase in accurate pain reassessments. Nurses demonstrated stronger consistencies in documenting pain scores and following through with timely interventions. Feedback from patients indicated greater satisfaction with comfort rounding. Patients appreciated that nurses checked on them proactively to address pain before it became severe. Another significant outcome was improved collaboration between the nurses and the anesthesia team. Clearer communication about post-operative pain levels led to quicker adjustments in the pain management plans. Lastly, staff reported increased confidence in their clinical judgment and teamwork. The training fostered an environment of shared accountability where every team member felt responsible for ensuring patient care, patient comfort, and safety. All right. Application and practice education. This project has strong potential for application beyond PACU. So it could be implemented even on like a med surg floor, um, possibly in the ICU with a conscious patient. But the educational framework and tools developed can be easily replicated in other preoperative or same day surgery settings to promote consistent pain management practices. It also serves as an effective orientation resource for new hires, helping them integrate evidence based pain management and comfort rounding standards from the start of their employment. The project aligns closely with Bon Secours GAME program and clinical ladder initiatives, which emphasize leadership development, evidence based practice, and quality improvement. Additionally, the evaluation methods used, such pre and post tests and perform audits, can be integrated into nursing informatics systems along to track a long-term progress and sustain improvements. Overall, this initiative strengthens patient-centered care, fosters accountability, and support the continuous professional growth for nurses at Bon Secours. All right. Let's see, the value of the project to lifelong learning. Completing this project has been one of the most meaningful learning experiences of my BSN journey. Through developing and implementing the training, I strengthened my leadership and teaching skills by guiding peers and facilitating education that directly improves patient outcomes. The project has reinforced the importance of evidence based practice and data driven decision making. I learned how to translate my research into practical interventions and measure them in real world time. Managing each days of planning, coordinating with staff sessions, and analyzing outcomes enhanced my project management, my communication abilities with the staff and my mentor, which are very essential for leadership roles in nursing. Finally, the experience solidified my commitment to lifelong learning and mentorship. I plan to continue promoting professional growth among my colleagues and advocate for evidence based practice, centered, patient centered nursing in every area of practice. So, thank you for joining me while I explain my project. Um, Please comment, leave your comments below if there's anything that I can do to improve my project. Thank you.